Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? I'm super excited today because I have Dr. Labrasca out of the Pittsburgh area, and you guys are going to hear a awesome episode today. Lots of gems and good treats that Dr. Labrasca is going to bless us with. So thank you for being on the show, Dr. Labrasca.
Thank you so much for having me. I'm super excited to be here. I've been watching the show on Instagram for, maybe close to a year, and I'm into it. I was super excited when you asked me to be on your show, so I immediately jumped on and said yes.
Thank you so much. I love to hear the feedback, and you are surprising me on TikTok with just how much your personality has come through and how it's really just shine bright, and you have all of these followers now.
Well, thank you so much. TikTok is super fun. I got into it early on back in 2020. My daughter, she was 10 at the time. She said, "Dad, you need to be on TikTok." I said, "What is TikTok?" And so she guided me through the first couple of months or whatever. And then all of a sudden I started getting a following, and I said, okay, let's actually talk about plastic surgery a little bit here. And it's just grown over time. And I'm really proud of what we've built here. And I love the app. I think it's super fun. And the interesting thing that I heard a long time ago, and I think it still holds true today, is Facebook, for example, will make you hate people you've known your whole life, and TikTok will make you fall in love with someone who you'll never meet. And it's just really nice for to build a community, and it's been a lot of fun.
Yeah, I believe it. I'm one of those people that leaves the comment like, it's too early for me to be crying this ugly this early in the morning.
Right. Yes, it is. It happens. And it's great when it does.
It is. I love TikTok because of the community you're able to build and bond with people who you've never met, who you're like, wow, like, I love you.
Right. Yes. Yeah. The interesting thing for me is in September, October of 2020, I posted a video. It was a simple before and after that I did, and I started getting consult requests. And I always have a group of like 3 or 4 patients who I just operated on, and they're posting about it. They're talking about it in my comment section and such. And that group leads to the next group of 3 or 4, and all of the little kind of pods, they become friends, and it's continued through the years, and it's just really fascinating. I have a girl from Pittsburgh now. She's young and she's a massage therapist, and she's really been talking about it a lot. And other people are saying, "Hey, I follow this patient," and she's gotten thousands of followers in the last month or two as well, and she will lead to the next pod of patients of mine, and it's just really neat. And they all learn, and they talk about, hey, what about this? What about that? And I'll chime in and I'll answer questions, and I'll post videos as well. And we all just kind of go through it together, live in front of the world, kind of.
Isn't it beautiful? Isn't it beautiful?
It really is. It's really, really neat.
I just broke it right before we started recording. I have this butterfly it was this crystal butterfly, and I like it because to me, the butterfly symbolizes like a woman going through her plastic surgery journey, because at the beginning, you're kind of shy, you're kind of scared, you don't really know what's going on, what to expect. And then when you're in your compression garment, you're kind of in that cocoon, you are just compressed and kind of like waiting for the good part. And then when you finally come out of your cocoon and you're out of your faja and your compression garment and you can start wearing what you want and you can do your makeup and you feel so good, the butterfly emerges. And I just love it so much.
I love that too. I think that's absolutely great. And yeah, and it continues even beyond there. I love when it gets to be May and June and July, because my patients from, 5 years, 3 years, last year, last month, they start, going out and they're taking their beach vacations, they're taking their cruises, and they're wearing a bikini, a two-piece for the first time in 30 years. I had this, so I'm in Pennsylvania. I had this woman from Oklahoma, and her husband found me, and really cool guy, really cool couple, and they came from Oklahoma, and like 3 months after surgery, he was sending me bikini photos of his wife saying, "I've never seen her in a bikini. Thank you so much. This is so wonderful." And that's what plastic surgery is for. It's to make people feel more comfortable than they've ever felt. And it's so great. We have such a great career, such a great field, such a great life. It's just the best.
It's so beautiful. I love it so much. So today, one of the things that I think we can do, and we're going to make this episode to help our girls have an easier time getting ready for surgery and giving them something to do while they count down the days to surgery, which we know once that surgery date is set, it's a countdown timer. How many days until the day of my transformation? So today's episode is what to do and how to get ready for your plastic surgery. Mommy Makeover, is our favorite. The something with the breast, maybe a little lipo, maybe a tummy tuck, and how to get ready for that. So today, Dr. Labrasca is going to bless us with 5 tips on how to get ready for surgery.
I scribbled this down here just a couple of minutes ago. So it's all based on the time frame. Let's say you're 90 days out. Okay. One thing that I like to say is, give me your best and I will give you my best. So what does that mean? You've got 90 days to diet and exercise and get in the right physical and mental mindset in order to give me the best version of you. And then I can deliver with my best. And if you can give me, like I like to say, let's say you weigh 160. I can give you this much. If you can give me 145, I can give you just that much more. And it's not that big of a deal. If you give me what you can and I'll deliver for you. So what I can say there is diet, exercise, just do something. Just try to get out there, whether it's walking or whether you actually like to lift weights or you like to dance or you like to do classes or Peloton or whatever. Just do it. Just do something. Try to give me a good high protein diet as long as you can leading up to surgery. I don't care specifically what it is, but give me your high protein diet. So if you come in fully proteinated and ready to go, you'll recover and heal that much faster. Now, let's say you skip 90 days and we're down to like 30 days. So for the 30 days leading up to it, I like to say, just be active. Don't start any new crazy diet any new exercise routine. If you exercise, keep it up. If you're not exercising, don't try to start exercising 6 days a week, because you're going to come in inflamed and irritated and burnt out, and you're going to have a harder time recovering. Just get out there and walk. Just be active. Do those types of things. Still be proteinated. Try to drink as much water as you can every single day. Come in very well hydrated. When you think you've hit your water intake for the day, drink another glass of water. Okay. So those are the things that we like to do just leading up to that first month of surgery. When it comes to after surgery, make sure you've got your help, and make sure that folks are there to help you. And as far as the exercise and the diet goes, the first week, just walk around. I like to say walk around inside the hotel room or walk around inside the house. For the first week. For the second week, walk around outside the house. Like if you have a house where the mailbox is at the end of the driveway, go to get the mail and come back, and that's about it. By about the third week, you can walk around the block or walk around the neighborhood. Those are your diet and exercise routines. leading up to surgery. There's a whole bunch of other stuff too. We can get into that whenever you're ready.
Well, that was awesome. So one of the things that you touched on that I want to really emphasize on this episode is working out your abs and your legs and your arms at leading up to surgery. Your abs, they're going to get plicated anyway. So I'm not too worried about that, but your legs will help during your recovery because you can't really use your core. So you'll be using your legs to get to stand up. And your arms, you're also going to be using your arms a lot more than what you expected. So having strong arms and strong legs help you recover faster.
Absolutely right. So there are plastic surgeons who will do a brachioplasty or arm lift at the same time as a tummy tuck. And there are even those who will do a thigh lift and an arm lift and a tummy tuck at the same time. I don't do that. I'll do like I like to say breast go with anything. Breast will go with tummy tuck. I'll do breasts with arms. That's fine, but I won't do arms and tummy tuck at the same time. And why is that? Because when you get your arms done, you need your core to move around. When you get your tummy done, you need your arms and you need your thighs, your legs all the time. We don't realize how much we use our legs until we get a thigh lift, because that's a whole nother ball game there. I separate things out more than some people do, and it's just because I used to not do it quite as much. I used to try and jam more things together, and I watched people suffer. And I watched people get DVTs as well, and the incidence of DVTs that I've had in my patients has gone down significantly since I started doing that. And I also am a little bit more aggressive with blood thinners as well, especially in patients who travel from far away.
Yes, I think that's something that we should, I probably haven't mentioned on the show, but we should, is that when you are traveling for surgery, or even if you're not traveling for surgery, but you have higher risk factors for a DVT, that could be genetic predisposition, that could be weight and height predisposition. It could be other reasons why, but they might put you on a blood thinner, and it's okay. I think we've had multiple surgeons on the show talk about giving their patients blood thinners. Sometimes it's the Lovenox injection. Now they have some tablets that they're also supplementing with instead. So don't be afraid if your surgeon says we're going to put you on blood thinners. It's a precautionary thing.
Correct. The number of postoperative bleeds that I've had have not gone up at all since I started doing it, and the number of DVTs have gone down since I started doing more Lovenox. And I don't do it on everybody. I do it on folks who travel from a long distance and have a long surgery, or folks who are at a higher risk depending on other medical conditions and age and things like that as well. So, but I found it to be only a benefit and not a negative so far.
Absolutely. So one of the things you put on your podcast guest questionnaire is that you won a rap battle.
I've won more than one, but yeah. So I love like old school 80s, late 80s, 90s raps, and even in 2000s. So I was in Vail with some friends, and we got on a lift, and there was this guy and this girl. They were about our age, maybe a little older. And my one friend says, "Yeah, my friend here raps." And the couple, they're like, "We rap too. I own a bar here in Lion's Head. Come down today." And it was the owner of a bar in Lion's Head. And later that night, we had a rap battle, and I won, even though he was the owner. So,
oh, that's so funny. I saw that. Oh, I love it. I love it. If you guys are not watching the episode, if you're only listening, you're missing out. Go watch it on YouTube so you can see what he did. So one of the things I also wanted to cover today was that how do you plan to sleep after your surgery? So This was actually influenced because I have a patient who's here in town and she's traveling for surgery, and she just had her surgery. She's about 7 days post-op, but the game changer for her has been her sleeping arrangements. And it's because we put her in a recliner lift chair. So she has not been struggling to get in and out of bed or off the couch. She has been in the recliner, and with the recliner, because she did a very controversial procedure, tummy tuck and BBL at the same time. And with that double procedure, of course, you can't be on your back, but you can't be on your stomach. So you have to sleep with your
floating.
Floating pretty much. So in a recliner, it's a lot easier, and you don't have to use your arms, and you really don't have to use your legs. So that was something that I really wanted to mention today on this episode about how to sleep during your surgery recovery. And how often do you hear, Dr. Labrasca, patients talking about sleeping in a recliner?
So these are things we talk about all the time. When I have folks that are local, they you can rent recliners and things like that, but it's important to rent one of those recliners that at least doesn't require you to use your feet to push the recliner down. If it's something that has like a push button, those are great to recline you or get you back up. And the ones that maybe that's the kind that you have that even help her stand up, those are amazing. Not everybody has access to those, but I think they're wonderful and they're super helpful for patients. What I do tell patients is sleep in what we say the beach chair position. So I'm going to demonstrate for those people that are watching here. So we bend the knees. Okay, we hunch the shoulders, we bend at the waist a little tiny bit, and it's kind of like a skier's position here. I like to ski a lot in the winter, so it's like a skier's position, and you do that for several weeks, and we do the same thing when they walk. It's the same thing when they walk and with the binder on as when they sleep. I have on my website, there's like an Amazon wish list, and I had a patient that had something that's essentially like the back of a chair and like a wedge that kind of goes together. And I've had other patients buy that since then. And it's also really helpful for folks who have a couch or just a bed to sleep in. Beach chair position. It takes pressure off the incision and very, very helpful. But yes, if you can get one of those recliners that you're talking about, that's fantastic.
Absolutely. And if you want to go into detail, tell us a little bit about your compression procedures. So
sure. Yeah. So I have a binder here. So it's just a simple abdominal binder, 9-inch, 3-panel, 30 to 45 inch. We do this on most every patient. And I have them wear it all the time for 4 weeks. After 4 weeks, they can take it off to sleep. And then after 6 weeks, they can be done with it altogether if they want. But I say don't throw it away because the folks, they tend to really like it after a while. And sometimes they need it, sometimes they don't. I like them to go then into something that's a little less aggressive. It doesn't necessarily have to be a faja. It could just be something that's a little compressive, like a Spanx or a Skims or something like that. Just pressure to hug the skin a little bit, because the skin, even at 6 or 8 weeks or whatever, it feels better when they're in that cocoon, like you talked about earlier.
Mm-hmm. How often do you hear your patients mention that at first the garment was uncomfortable, but then that it became something that they really felt like they loved being in?
Absolutely every day. They do the first week. Oh, I hate this thing. I can't wait to get rid of it. By the time they're 4 to 6 weeks, they're like, do I really have to get rid of it? And I say, no, you don't have to. You don't have to get rid of it, but you maybe wean yourself down on it. See how you feel. If you feel well without it, then don't use it as much. But if you need it, it's there. Make sure you have it.
Wonderful. So something that this is, making me think about is how there's so many different opinions online about, oh, you should be wearing this or you should be wearing that and you should wear it for this long and don't do this, don't do that. And it's so hard for patients. I mean, honestly, so hard for patients to decipher what should I really be doing? Which is why I made this show. I launched this show and I talk to board certified plastic surgeons to talk specifically about what should these ladies really be doing? Not what so-and-so from down the street who doesn't have a medical license. No, let's see what the surgeons are saying.
You're absolutely right. And it is exactly what you said. Everybody has a different opinion. So what does that mean? There's no cookie cutter exact right answer for every surgeon or for every patient. I had a patient, she's now just over 2 weeks post-op, and the binder was a little too much for her that first week, so we backed it off. I like to say, when they ask how tight should I wear the binder, I joke and I say just to the point where you can't breathe, and then back off an inch. And for her, I said, yeah, just don't make it that tight. Just make it so it feels snug and not that tight. And she did so much better between week 1 and week 2. I saw her back yesterday than she did that first week.
Wouldn't you? This is what I like to tell my girls whenever they're talking about, oh, I'm ready to get into a stage 2, and they just had surgery a week ago. What are some of those risks that they don't know they're taking when they do try to get into a garment that's too tight?
Well, you get into fluid shifts, and there's also, you can get pressure sores, and you can get wounds, and you can get skin necrosis from wearing something that's too tight and that you're not ready for. You could also set yourself up for something called atelectasis in the lungs if you can't take deep breaths, and that can lead to pneumonia. So these are things that just follow your surgeon's instructions. It may be your first time, but it's not your surgeon's first time. And if it's your surgeon's first time, you made a mistake. Okay. All right. So, so tomorrow I'm going to operate on a couple of women, and it's a monumental day for them. One of the most important days of probably their entire year. For me, I call it Wednesday, and that's only a good thing, because what does that mean? Business as usual. I will go about my day exactly as I do every other Wednesday, and I'll deliver for my patients, and they'll do fine.
I love it. I love to hear that. So one of the things I want to touch on before I let you go is social media and its impact on patients' expectations and what they believe can really be achieved through surgery.
Sure. Well, I have a couple of things. Let's hit on a couple of things. One thing is when people say, why would anybody go to a plastic surgeon that they found on Instagram or Facebook or TikTok or like whatever? And I think about it like this. 10 years ago, 15 years ago, how did you find your plastic surgeon? Well, you opened up the yellow pages and you looked for plastic surgeon, and you found the person who had the biggest ad in the yellow pages, because clearly that was the one that had the most experience, because he or she had the most money to get the biggest ad. And you'd call up and you wouldn't necessarily know who it was. If it was a male or a female, sometimes it's hard to tell. And then you would go in and you would, let's say you're trying on breast implants, you'd try on breast implants, and then you'd leave and you'd hope that you picked the right size. Versus now, it's you go and I have hours and hours and hours of tape of me talking on social media, and I've got before and afters out the wazoo on social media. So you can get an idea of what I'm like, because I can be a lot. I'm out there and I'm like this all the time. I'm high energy all the time. And that may not be for you as a patient, or you may love it. And you'll get an idea of what results you're going to get based on your body type and before and afters that I've got on there. And then you can come in and let's say you try on breast implants. You can take pictures on your cell phone, and I encourage every patient to do that. And then they can go home, and if it's 2:00 in the morning and they're like, I really hope I picked the right size. Let me see here. Let me take a look. Okay, let's see. Okay. Oh yeah, that looks good. I like that. We're gonna stay with that. Or you send to your girlfriend or your mom or your whatever. Hey, what do you think about this? And they say, oh, maybe it's a little smaller, maybe it's a little big, and come back again and try it again. And so like those are things that are like really really good as far as choosing a plastic surgeon from social media. So that's the one thing that I think is probably the best part about social media for plastic surgery.
What do you think is the worst?
The worst thing is the fact that you can have hours and hours of yourself on social media. Sometimes we plastic surgeons, sometimes we can't hold our tongue. And, sometimes if you say something wrong, it's out there and it's never going away. I've been lucky so far. Okay. But if you get a disgruntled patient out there, and they're mad and they post a bunch of stuff and it gains traction, then it can really do some damage.
Yeah, it can do some damage.
And it can do a lot of damage for surgeons who, we try our best every single time. I mean, I know I do, and I just assume every other plastic surgeon tries their hardest on every single case, every single patient. And it doesn't always go the way that we want it to. And sometimes patients don't get the best results. Most of the time they understand. And if I don't get the result that I want on my patients, I do my best to revise and do whatever I have to do to fix it. And I assume others will as well. And so far my patients have been good at letting me do that. Other surgeons have not been as lucky, and that's tough. And I feel bad when that happens, and I hope it doesn't ever happen to me, but it could. Things happen to every surgeon. And to be clear, I feel super bad for the patient as well when they don't do well. I think that's probably the most important thing is, letting the patient know, hey, I'm really sorry that this wasn't exactly as I expected it to be. Let's try again.
Mm-hmm. And I think honestly, for myself, I was a patient coordinator for 14 years before I left and launched my show. So I went through lots of patients who maybe their expectations were higher than what we could deliver, what reasonably could be delivered, or maybe something unexpected happened during their recovery that set their results back. Things happen, and it's unfortunate when they do happen, but it's also why I preach from the top of the hill. The surgeon you choose matters, because if it's an ethical guy who will take care of you and take responsibility, that even if your result is not perfect, they will make sure that they do whatever they can for you to be happy with your result. Within reason.
Correct. Funny you mentioned that. I had someone send me a DM on TikTok or Instagram just today, and it said, "Hey, I just was looking at places in Tijuana today, and this is how much it costs in Tijuana. Are you about the same as that?" And I said, I don't know how much it costs in Tijuana. I don't try to compete with prices in Tijuana, but what you'll get from me is my vast experience in the surgery that you're looking for in the United States, in a hospital near Pittsburgh, Pennsylvania, with real anesthesiologists that are board certified in the United States. And if something goes wrong, we have general surgeons, we have cardiologists, we have pulmonologists, we have critical care, we have gynecology, we have all of those things that are right at our fingertips if something terrible would happen. And you're not going to get that in Tijuana. It's just not, right? So you can take the risk and maybe it'll come out great. My life matters. My patient's life matters. And so I'm not going to take that risk.
Yeah. That's one of the reasons why I launched my show, actually, was during my last year as a coordinator, we had so many patients coming with issues from coming across the border where incisions weren't closing, or they were closing and unraveling. And the sutures were just like sutures I've never seen. Things were, what? How is this happening? Oh, they told you they'd fly you back the next day after your tummy tuck? What? No, don't let them put you on a plane the next day after your tummy tuck. No, even if they're saying it to you so you can pick them and recover at home, that's not, you don't want to be on a plane the next day after your tummy tuck. These things that I was like, wait, hold on. Is this real life? Is this really happening? Are there really people out there doing this? And I took a deep dive, and I found so much stuff that I got scared for my girls. I'm like, oh my God, I have to do something. They have to find me before they find them, so that they can learn what to look for, and what are red flags, and what should I really be checking out for before they fall into these unethical practices.
Right. And there's more than I ever imagined there were. Some of the things that I like to do is, so folks come from everywhere, but for me, if you fly in and you get a tummy tuck or a mommy makeover or whatever, you can't fly for 2 weeks. You stay in my area for 2 weeks. And if in 2 weeks, you're going to find out if there's a major complication, and there's going to be time to fix it. If after 2 weeks, it's going to be minor stuff, revisionary stuff, things like that are much easier to handle, even remotely. If you come in just for for an arm lift, like brachioplasty or whatever, you stay longer than a week, 8, 9, 10 days or whatever. But if you drive from Ohio or New Jersey or whatever, folks still stay a week, and then they go home, and then they come back for their 2 week. But those are things, I think those things are super important, because I can't help you if you flew back to Oklahoma or Nebraska a day after your tummy tuck and had a complication. I'm not there. I can't do it. And I hate that people do that. It drives me nuts. And it makes me feel so sad for the patients who just thought they were just going to get a tummy tuck, and it was going to be easy, and that was going to be it.
Yeah. So I learned a lot of patient education really needed to be done. And unfortunately, they weren't getting it until after the fact. Because one of the things that I do is I offer free discovery calls. So my girls will call me to talk to me and ask me questions. And I was hearing these stories where I'm like, oh my goodness. And they'd tell me, I wish I had found you sooner. I wish I had found you 2 years ago. I wish I had found you 4 years ago. And the past is past. I wasn't here then, but I'm here now, and I'm screaming it as loud as I can. Be sure to research your surgeon, your surgery, your recovery, and be 100% ready for this new era of you that's coming. But it comes with a lot of responsibility.
Yes, it absolutely does. I think it's great. I think you're doing a wonderful thing for so many women. It's absolutely needed. I had no idea how needed it was until I've had to do a 4th tummy tuck twice this year. So 2 patients have had 3 previous tummy tucks, and I did the 4th one twice. I never in my life thought I'd do that, but I did, and both did very, very well. One came from LA, all the way from LA, and the other one was from Seattle or something like that. So yeah, it's wild.
Nice.
Rhode Island. The second one is from Rhode Island.
Okay. Well, before I let you go, Dr. Labrasca, I always ask this one question. Are you team drains or no drains?
I am team 2 drains. Okay. And why is it that I use drains? Because one of the things that I think that sets me apart from some other plastic surgeons is I'm a little bit more aggressive with the liposuction with my tummy tuck. And so I aggressively lipo the flanks area, and I even lipo in the abdomen, in the the superior abdomen area that a lot of people don't liposuction. And with that fluid, the tumescent fluid that I put in there, it has to come out. And so I place 2 drains, and the first one comes out after a week, and the second one usually after 2 weeks, but I'll leave it up to 3 weeks in some cases. And it's just, for me, it's necessary because of the amount of liposuction that I do. I know some people can get away without doing it, but it makes me too nervous, especially if they come from out of state and they get a seroma. It's because the drain wasn't placed. So.
Exactly. So they're keeping a tally. So he said team drains. Let's see. I'm going to make a count for all the plastic surgeons we had on the show this year and see how many were team drains and how many were team no drains.
I love that.
The majority The majority are team drains.
Yes. Yep. I'm sure of it. I think the ones that don't do drains are doing very more petite women. I think it's that. I think it's a less aggressive tummy tuck. In my head, it is anyway. I have no data to verify that, but I just think it's a lot less undermining and more, smaller women and less liposuction.
Less liposuction
compared to what I do.
For sure, I think.
Yeah.
I think that's for sure. So, Dr. Labrasca, if any of my girls want to come see you, how can they find you?
Sure, you can find me on all the socials, on Instagram, TikTok, Facebook, and I have a very small, very slowly growing YouTube channel as well. But it's all Dr. Labrasca or Dr. Labrasca.
Awesome. So you guys heard it here first. And if you want to go see him, go visit him in Pittsburgh. Tell him you heard him on the Big Butts No Lies podcast and say hi for me. I'll see you guys next week. Thank you for being on the show.
Thanks, Mavi.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey. And don't forget, new episodes every Monday. I'll see you then.